Hi, my name's Nicole Jones from the Physio Crew, and today I'm here to tell you about some structures in the knee that we'd want to be checking if you had a knee injury. So a lot of people who play sports, it's very common to get knee injuries, and there's some structures that we are concerned about and there's some that we're not so concerned about. Anybody who has a twisting injury where they hear a pop or they have immediate bruising or swelling, those are definitely the sort of people that we'd want to see to rule out that there hasn't been any severe sort of ligament damage or cartilage damage. So when we look at a knee, what we've got here is we've got the femur, which is the thigh bone, and we've got the tibia, which is the shin bone, and then the fibula, which is the outside. So the blue that you can see here is the cartilage. So you have two types of cartilage. You have the squidgy cartilage in the middle, and then you've got the very smooth cartilage that you see on the outside of a bone, and that's the same as sort of what you see on a chicken leg. When we're looking at diagnosing what's going on in the knee, it's really important that we understand the mechanism of injury. So we understand whether it was twisting or hyperextension, so going back on itself, or whether it was sort of a giving way episode with a sort of turn like this. If we can work out where the impact came from, then we can work out what structure might be affected. So for example, if the leg is going to go this way, we're more likely to damage the ligament on the outside. If we come inwards, we're more likely to damage on the medial side, the inside here. So sometimes what can happen is you can have multiple structures as well, and that's quite common with the ACL, which is everyone's sort of worst nightmare when we say that when we're coming in for the sports athletes, particularly women footballers or women rugby players, because it's quite common. So just again, a little bit more anatomy. This is the patella, so I'm just going to pull that one out of the way so you can sort of see within the knee joint itself. And within here, there's two ligaments that cross over each other. And this is your anterior cruciate ligament and your posterior cruciate ligament. The anterior cruciate ligament attaches to the front of the tibia here, and it stops the movement of the tibia coming sort of forward like this. The PCL, the posterior cruciate ligament, does the opposite of that. So if we were looking for a posterior cruciate ligament, we'd be looking for a sag sign, which would mean that the tibia would have dropped back slightly. With an ACL, what we do is we do a test to see whether there is a clear end feel. So on a physio assessment, what we would be doing is looking at how you're moving, asking about the mechanism of injury, but then also looking at doing some tests to see whether this ligament is a problem or the ligament on the outside is a problem, and also the ligaments in the middle. These are the things that we want to check. We're going to look to see if there's any evidence of dislocation of the patella. That normally you're going to know about, and normally people can visually see that it looks abnormal, and it will normally be either put back in spontaneously or we'll go to A&E for it. But physio is very important in the recovery of that, because if the patella is dislocated, you're going to damage this ligament on the inside here. It has to happen for it to dislocate. So what we do is a lot of work on helping that to heal if it hasn't ruptured, and also then making sure that we're working the muscle to pull the patella back into a more normal alignment. The other key structure that we have to check is the menisci, which is in here. So you have the medial, which means to the inside, and the lateral, which means to the outside, and we do various tests to check that. So those are probably the biggest things that we would be worried about in a knee, and those are some of the things that we do to test them. I hope that's been helpful for you. Thank you.